Time and again, Ontario Premier Doug Ford promised his government would put an iron ring around seniors in this province. But as the government's own Long-Term Care Commission established, residents and staff in that sector have been disproportionately affected, heartbreakingly so, during the COVID-19 emergency. With us now on why, and we'll introduce our guests, as is our custom, from furthest away to closest to our studio, starting in Waterloo, Ontario, with Peter Shawn Taylor, Senior Features Editor at C2C Journal. And in Ontario's capital city, in Scarborough, Vivian Stamatopoulos, long-term care researcher with Ontario Tech University and co-founder of the advocacy group Doctors for Justice in Long-Term Care. In the St. Lawrence market area, Donna Duncan, Chief Executive Officer of the Ontario Long-Term Care Association. And in Little Italy, Pat Armstrong, Distinguished Research Professor of Sociology at York University, and we're glad to have all four of you on our program tonight. I'm going to ask Sheldon, that's a good shot. Let's keep that four shot up because, there is an independent commission right now tasked by the province to look into the whole, disaster that long-term care has been over the past year, the disproportionate impact that seniors have taken during this COVID-19 outbreak. Can I just see a show of hands? We got four experts here who know this area really well. How many of you have offered testimony to this Long-Term Care Commission? Show of hands, please. 1, 2, 3. Okay, Peter, not you. So let me find out from the other three of you. Donna, why don't you go first? How useful do you think the exercise was?
Well, we called for a commission, Steve, before it was actually struck, but it was struck, in our view, it needed to focus on actions, reflect, validate on what the root causes are, even though I think we all saw what was coming, but focus on what are the solutions and how do we move quickly to mobilize towards that. We've had lots of reviews, lots of other commissions, but for us, it was validating, and we're looking forward to seeing the recommendations, but with a focus and a bias towards action.
Okay, Vivian, a useful process in your view?
It was, and although unfortunately I didn't get a response to my request to be interviewed, I have read the transcripts and it was very eye-opening what we learned. So there is no question of a doubt that they are helpful. What we will do with that evidence is another question. Will this government actually use it? We don't know. Now,
you said you asked to make a deputation. Do I assume then that you presented them with your findings or a report, but they didn't call you as a witness?
Effectively, I inquired to them, how do I go about providing a testimony? Because I'd like to, and I never heard back.
You never heard back?
No.
That's a bit odd, don't you think?
Yeah.
Yeah, you think so too. Okay. Pat Armstrong, how about you? Was it a useful procedure in your view?
Yes, I think that especially their early recommendations, not waiting till the end to come out with suggestions around staffing, for instance, or around inspections, I think was very useful. I also think that the testimony is very useful. When we have access to that kind of public information, it's very important, I think, in moving us ahead out of this crisis and working to make long-term care as good as it can be. And we're far from that right now, before pandemic, but especially at this period in time.
Well, let me pick up on that angle with Peter, because Peter, okay, you did not participate in this, but Pat is right. They have published the testimony of the witnesses. And this past week, we discovered some of the testimony from the Minister for Long-Term Care and for Ontario's Chief Medical Officer of Health. What did you learn from their testimony that you didn't know before?
Well, I think it's filled in some shading. I mean, we knew that there was a lot of confusion going on early when the pandemic hit. We didn't know, people in charge didn't really know how to respond. Certainly the hospitals have responded more effectively than the long-term care homes. So it gives you a sense of how the various leaders were kind of flailing around a little bit to figure out how to respond. Obviously, it had major consequences, but I think we kind of knew that story before the commission. I stand to be corrected if some of the other experts think we're learning new stuff, but it seems to me it's reinforcing the fact that there was a lot of flailing around.
Well, flailing is an interesting choice of word, and Vivian, I'll get you to comment on that. If in fact this group has demonstrated that it did too much flailing in the beginning, Why should we trust them to figure this out at this stage of the game?
The government, you mean?
Indeed.
Well, we don't. I don't, personally. And that's probably the most upsetting part, and which is also why I have a separate advocacy team that is working on national standards right now, because we're very firm on the opinion that some provinces are going to be difficult in actually making the kinds of changes we need. So we're starting to put our eggs into the federal basket, so to speak.
Pat Armstrong, do you have faith that this crew can figure this out?
Well, I think they can highlight what we have known for a very long time, our problems in this sector that have been exaggerated by COVID. So I think that there are points in time where particular kinds of interventions can matter. I've personally been studying this area for 25 years, saying many of the similar things, but maybe we're at a turning point. Maybe we're at a place where it can make a difference. For instance, around the 4 hours minimum of worked hours for care, we've been arguing for that for a long time. And in fact, those numbers are outdated. But if we could do that immediately rather than planning for it over 4 years, as we've heard, then I could think it could make a huge difference.
Well, they've said they're not going to do it immediately, that they will do it over a longer period of time. So what do we conclude from that?
Well, I'm worried about that. I'm also worried that the vaccinations are already dramatically reducing the death rate. So we'll say, oh, that's yesterday's problem. We can move on to something else. But we have to fix this now. We've had many opportunities, as we've already heard. And as the Royal Society report said, we've studied and studied and studied. It's time to act on it now.
Well, let me put that to Donna, because our previous guest, Andre Picard, did point out in his book that I think he added them all up. If you take parliamentary inquiries, task forces, royal commissions, committee reports, and so on, he's got it up to 150. And he says almost all of them have made great doorstops, but they haven't really been acted upon. Do you have any reason to believe that this one will be different?
Well, Steve, to Pat's point, I think this government has committed to increasing that to 4 hours of care. That's progress. We've got to hold them accountable to making sure that happens. And the sooner the better. I agree. We need to move quickly on that. Progress on the 3 and 4 bedrooms and moving capital along. In our data and our analysis, one of the most shocking findings that we actually saw was going to compromise the health and well-being of our residents to tragic consequences was the impact of 3 and 4 bedrooms and those old homes. And we'll give this government credit for starting to move on that, because it takes 3 to 5 years to rebuild. We know that we're not going to build enough. We've got to look at a full system of care. And I believe that it's going to take all of us working together to problem solve. And I'm not going to look just to government to actually find the solutions. I think we can develop solutions with them and drive government to actually deliver on them. But waiting for government to solve the problem, all of those reports are there. Let's build our roadmap on ourselves, and let's celebrate incrementalism and move this forward as quickly as possible. We've got to meet that baby boom bomb that's about to hit.
Vivian, our director took a cutaway of you during the midst of that answer, and you had a bit of a skeptical look on your face. Do I infer correctly from that?
Yes, you do, because we know that even for accounting for facility design and chain ownership and community transmission, the Toronto Star just published data for the last year in total. And all of those factors aside do not count for the fact that for-profit homes still have many more deaths. I mean, the difference is significant. So 7.3 deaths, COVID-19 deaths per every 100 beds for the for-profit sector, all the way down to only 1.5 for the municipal sector, right? And I want to remind everyone that this government, Ontario, and this started with Mike Harris, have increased the capital development funds for homes to rebuild and upgrade 4 times now over the past 2 decades. And while many homes did do just that, for some reason, the for-profit homes didn't decide to. So why are they going to do so now?
Well, as long as you bring these numbers up, I was going to get to this later, but we may as well do this now. Sheldon, middle of page 2, let's talk about this private versus public ownership situation. We got more than 600 long-term care homes in the province of Ontario, and here's how they break down. 360 are for-profit, 162 are not-for-profit, and 101 are run by municipalities around the province of Ontario. Let's continue, and this one will speak to age. We have a lot of homes that are designed and built before 1972, so they are coming up on a half a century old. More than half of for-profit homes are coming up on 50 years old. More than a quarter of not-for-profit homes were designed and built before 1972, and just over 10% of municipal long-term care homes are coming up on 50 years of age. Okay, Pat, tell me about the significance of let's go to that second set of stats first of all. The significance of the fact that we have a lot of stock out there right now that is coming up on a half a century of age. Why is that important?
Well, it is important to get rid of the 4-bedrooms for sure. But as Vivian pointed out, that there's been money there to do that for quite a while, and it hasn't been done. I think we do have a long series of studies that indicate a pattern of lower quality care in the for-profit homes, and certainly of lower staffing levels and lower pay and more part-time staff in at those for-profit homes. So when we're talking about a pattern, of course, we're not saying all for-profit homes are horrible or all municipal homes are wonderful, but we do have a pattern, which is what we always look for in research, just like we do in terms of the vaccines are only 80% effective. They're not 100%. It's not about 100% of the homes, but we do have a pattern. And I don't think anyone's saying tomorrow morning, get up and get rid of all of the for-profit homes, but that we should work in that direction. And we should also work in that direction in terms of, I would argue, contracting out the services within homes, because we have similar kinds of evidence there as well.
Peter, why haven't those investments been made over the years?
Well, I'd like to talk to Vivian's point first, perhaps, that it's self-evident that for-profit homes are delivering poorer care. It's not the case. I wouldn't take the Toronto Star as my objective source of truth on this. They planted their flag as soon as the pandemic started. It's been a nonstop series.
Okay, Peter, hang on. Just let me just say for a second that all the numbers we just gave are not from the Star. I'm going to give the Star numbers in a second, because they did do a deep dive this past weekend. But all those numbers are from Nathan Stahl, CMAJ journal numbers. So that's
exactly
just to correct the record.
Sure. So let's use those figures. And that figure found that there was no statistical significance to being a for-profit nursing home. The factors that explained why there were outbreaks were the size of the outbreak in the region surrounding the home, the age of the home, and the number of residents in the home. So if you read that Canadian Medical Journal article, you'll find that the for-profit isn't a factor. So let's put that on the table to start with. So going forward, what do we want? We want the best possible situation for seniors. We should be taking all the recommendations that are out there. I haven't seen any recommendations from, for instance, the National Institute on Aging just came out with a series of recommendations on how to improve things. They don't talk about ownership, they talk about regulation. So I think the for-profit and nonprofit can both benefit from new regulations.
Okay, Vivian, let me just, I'll basically sum all this up and then I'll get you to comment on it, because that Canadian Medical Association Journal study suggests that there is a statistical insignificance between profit and not-for-profit when it comes to safety of residents. That's the conclusion they came to. You're disputing that?
Absolutely, I am. There are many problems with that paper, and I've talked to Nathan directly about it. But furthermore, it's a bait and switch argument here. So what we're seeing is that the advocates reading the first part of the paper and ignoring the rest, right? So they don't pay attention to the fact that community transmission apparently, and this was only up to wave 1. So subsequent data the Toronto Star found that has been concurred by other epidemiologists, very well-known ones, have agreed that finding is there, that ownership does matter. So that aside, it only looked up to wave 1. And there's a little bit of an ecological fallacy because you don't know if the workers actually work in the areas of the community transmission that they looked at. But that aside, it still found that once the virus gets into the home, and this is what matters the most, how do the for-profits handle it? And the rest of that paper outlines in black and white that they fail to control that outbreak. And that's what matters. Getting one outbreak, getting one case, that's an outbreak, is not the issue. It's how you manage it once it gets into the home. And they can't. They've had the deadliest outbreaks and the highest mortalities. And even the Stahl paper found that. So
can I just follow up with you on that? Let me just follow up with you on that. We know there have been outbreaks in lots of long-term care homes across the province. Once the outbreak hits, why would, in your view, the level of care in for-profit settings be any different from in not-for-profit settings?
Well, I'll tell you why, because it boils down to staffing. And that's also something that the Stahl paper didn't have. They don't have information on staffing because this sector refuses to publicly make that information available. Correction, the for-profit sector refuses to make that information publicly available. So we know, frankly, that ownership matters when it comes to staffing. Staffing matters when it comes to managing outbreaks. It is irrefutable that the for-profit homes hire less staff. They hire less full-time permanent staff. They pay their staff less, and they produce less hours of direct care per day. And you know why? You know how that impacts to resident care and the COVID outbreak? Because this is what happened. When the April 22nd directive came limiting employment to one home, what do you think happened? The workers at the for-profit homes left. They left for greener pastures. They left for places that paid them better and had better working conditions, period. And that was corroborated all throughout the testimony in various different testimony transcripts in the commission. So we know that. And then we saw in black and white, all of us saw this in real time, in addition to the testimonies, that what happened was that many of the for-profit homes were in a mad dash to find workers. Oftentimes, they threw workers without proper training onto the floor in the worst time, possibly, period. And what happened was negligible infection prevention and control mistakes were made that led directly to resident deaths. I mean, this is a very clear causal chain here. I mean, we have evidence, Sunnycrest, Tender Care, Roberta Place, ministry inspectors reports showing clear negligence that resulted in increased death. We have leaked paramedic reports from St. George.
I hear you. Let me give Donna Duncan a chance to respond. Lots of stuff to respond to there. Donna, go ahead.
Yeah, certainly. And, we're going to agree to disagree with Dr. Vivian insofar as, our for-profit homes, our nonprofit homes, everybody struggled in this. As Andre Picard said, this wasn't a fair fight for anyone. If we look at the ownership of homes, the larger chains and private homes largely are for-profit homes because the nonprofit and charitable homes were rebuilt during the Harris government in 2000. The last time we had any significant movement, we have members of all ownerships who have made multiple applications to rebuild these homes over the last 20 years, and it hasn't happened. And
why not?
Yes.
Why has it not happened?
If we look back to 2007, when the Liberal government of the day made an announcement and a commitment to two things: aging in place and rebuilding these older homes. They moved forward in aging in place, but they didn't move forward on these homes, and we are seeing the consequences of that, and we need to move quickly. And I think the other thing I would say that. And just to echo Andre Picard, we're getting caught in a divisive, polarizing debate around ownership. We don't have the luxury of time for this. This is a very emotional debate. I know, I feel it. We've had tragic loss. But quite honestly, we need to mobilize to work towards solutions, to find our way through. We need to build a workforce. We need to work to build out that force of care. We need to rebuild these homes, and we need to find a way to rebuild confidence, rebuild the morale and the mental health and well-being of our residents. Because I don't think it's an overstatement to say that all of this fighting and this polarized activity is having devastating consequences on our existing workforce. And as much as our government has tried to attract people in, money's not going to help. Morale's going to help. And how we talk about this workforce and how we support the workforce and focus on the people who are living in these homes and working in these homes, we're not going to make sure, we're not going to have a system that's going to be able to support the care.
All right, let me get Pat Armstrong on this. Pat, do you believe that there is a difference in the quality of care and in the ability to fight COVID-19 between for-profit and not-for-profit long-term care homes?
Yes, I think we have considerable evidence to indicate that. Do I think it's the only factor right now? No, it's certainly not, but it's certainly a factor, I think, from all of the evidence we've had. And as I said earlier, we had evidence pre-COVID of more hospital transfers, more bed ulcers, higher mortality, for instance, in for-profit homes, a clear pattern. So, and the staffing levels, as Vivian pointed out, are absolutely critical. And not just the staffing levels, but the proportion of staff that's part-time. And that's true across all of the homes, but we know that that proportion is higher in the for-profit homes. We do have to increase the full-time staffing across the board in all of the homes. It's absolutely critical. we do have to make regular training available to all of those people in the home. That's not to say people aren't skilled there now, but all of us have to constantly upgrade our skills. I do. I have to keep reading as I teach. That we have to keep training. We have to keep providing people with the kinds of supplies they need in terms of long-term care. So there are a lot of strategies we have to follow it. Addressing the for-profit one is just one of those strategies, but I think it is a strategy we need to follow.
Okay, well, I think Vivian referenced the fact that the Toronto Star came out with a really lengthy article, a series of articles actually on this past weekend. And Sheldon, I'm at the top of page 4 now. Maybe you could bring up that first graphic on the top of page 4, because the Star, now this is a complicated looking graphic, and for those who are listening on podcast, I'm going to go into just a little bit of detail here and explain what we're seeing. We're looking at COVID deaths in for-profit long-term care homes. This is as of the 22nd of February of this year. And the Star found an average of 7.3 deaths per 100 beds in the for-profit situation, 7.3. They compared it to 3.8 average deaths per 100 beds in nonprofit homes and only 1.5 average deaths per 100 beds in municipally run homes. So their conclusion is, and Peter, I'll get you to comment on this first. Their conclusion is the for-profits didn't do nearly as well as the not-for-profits or the municipals. What would you react as far as that study is concerned?
The Toronto Star has had that conclusion since the very beginning, regardless of the evidence. The little charts there with the little bubbles, that's not as sophisticated an analysis as the Nathan Stahl piece in the Canadian Medical Journal, which ran everything through and found, to repeat myself, the findings of that study, peer-reviewed, using advanced statistical methods, is that for-profit was not a significant factor. It was the community, the size of the community outbreak, the age of the building, and the size of the building. And to Vivian's point about how there's been more deaths in the long-term, in the for-profit long-term cares, it's because they're running bigger buildings that were built to older standards. And that's what the finding is, and that seems perfectly logical to me, that the 4-bed ward is being identified as one of the most significant factors in this whole thing. And the fact that the for-profits have more 4-ward beds simply reflects the fact that the for-profit sector has been there for the province for a lot longer than the nonprofit or municipals. They were the ones delivering this service for decades.
All right, let me ask the follow-up question then, Peter. The follow-up question is, what would happen if the province of Ontario made the decision to to completely get out of the business of allowing for-profit long-term care homes in the province?
It's completely impractical. Already they're providing almost 60% of all beds across the country. For-profit provision of long-term care is the dominant model. It's 37% across the country. So you simply can't survive without the for-profit, without the private sector involvement in this. It is absolutely essential. And if you remove it, you're going to spend hundreds of billions of dollars compensating, and you're going to spend money that does nothing to improve the situation. All you're going to be doing is paying private sector to turn things into nonprofit with no gain there. You're not going to add anything to the capacity of the province or the country. And we know that we're going to need substantially more beds in the future. Where are those beds going to come from? It's going to be the private sector.
Your view on this is clear. I want to hear from Vivian and then Pat on this same question. If the province decided to outlaw for-profit long-term care homes in the province of Ontario, what would be the impact of that? Vivian, you first, please.
Oh, first of all, we're not asking for that. And this is an argument that has been embedded by the for-profit individuals. Nobody is saying to buy up all the homes. Nobody has ever said that. That is a fear tactic.
Vivian, the NDP is arguing for it.
They're saying in time. What they are saying is that when the contracts come up for expiration, which some of them do at varying different times, so this is not something that would happen tomorrow. They're saying when those contracts come up for expiry, don't renew them. Don't renew them because the evidence doesn't support that you should. We have glaring evidence against for-profit it's anti-evidence if we continue along this dysfunctional status quo that we saw firsthand led to the worst mass casualty event in our collective long-term care history. It is frankly offensive to try to say that this is a divisive strategy to pit people against one another when frankly, this is the workers speaking up. The workers felt betrayed by these for-profit companies. The residents felt betrayed. The public feels betrayed. This isn't a few of us that feel betrayed in academia. No, this is the public. And I just want to remind people that 86% of Canadians were recently polled and said that they want long-term care within the Canada Health Act and operated not unlike hospitals because they saw that hospitals were prioritized and long-term care wasn't.
But if they knew, I appreciate that survey, but if they knew, and I'm just asking here, I'm not trying to advance a view here, but if they knew that it would cost tens of billions of dollars to repatriate those currently privately owned long-term care homes into the public Medicare system, would they still be as in favor of it, do you think?
Yes, I do think so. And frankly, we pay for it regardless. So let's not act like the for-profit sector is giving us a gift. They're not. In fact, we are helping them to secure real estate investments across Canada. We are making them very wealthy in the process. So let's not pretend it's a present. We can give this to individuals who actually operate more ethically and follow clear evidence that suggests if you do this and you have certain staffing policies, we know it leads to better resident care. But instead, we have a for-profit sector that uses a business model that tries to skim off the top. And while they're doing that, they're doling out tens of millions of dollars every month to their shareholders while residents die in neglect.
Okay, Pat Armstrong, let's hear from you on this issue.
Well, first of all, I would say that the article written by Stahl and others was the first wave, and the data that you just showed is second wave. So there are different issues coming up here. And I'm really surprised at the notion that the not-for-profits and municipals don't have old homes. I've been in all of the Toronto homes, and I can tell you quite a few of them are old still, although they're moving significantly towards improvement. So, but I don't really think that we need to get bogged down in using one article as our evidence for what's happening here. And nobody's arguing that tomorrow morning we're going to take over all of the for-profit homes. I think the argument is, given the evidence, we should move in that direction. And I think it's also a question of to whom are they responsible on a regular basis. And, you know, for-profits have a responsibility to make a profit. That's the point. So it's not to say these are mean or awful people, but that is what you need to do. And that means that money is not going to care. And when we're talking about what's the advantage of having a for-profit home, it's not in terms of cost because we pay the same amount of money. It's not in terms of choice because, you know, we have 38,000 people waiting for a home. And so they're not getting a lot of choice. And the other argument is the capital. But as Vivian just said, we pay for it in the long run, and we pay more for it if it was our capital going in. But of course, we can't do this overnight, that we can't take over 60% of the homes.
I understand. I've got a minute left here, and Don, I'm going to give it to you and let's just put the scenario out there. If the NDP wins the next Ontario election, their view is we're going to nationalize all currently privately held long-term care homes in the province of Ontario. You will meet with the new Minister of Health under those circumstances, and you would tell him or her what?
Well, I'm going to say it's going to be like auto insurance under the Ray days, where they made a commitment to make auto insurance public, and they couldn't do it. It's astronomically expensive. It's not the problem we need to solve. I've been meeting with my global partners throughout the pandemic since last January. This is a global pandemic we're in. This is a global issue around staffing. It's a global issue around the buildings. And I think we do need to have a bigger discussion about what is long-term care and how do we take it out of a cookie cutter box? How do we stop personalizing this as an issue and make it about the people and the population we need to be able to serve, whether that's new models of care that are closer to the acute care or subacute continuum versus housing? How do we support people from independence into care in a very respectful, person-centered way and make this about our seniors and deal with the ageism and focus on those problems, not on actually doing something that will profoundly destabilize the economy and destabilize the sector just as the baby boom bomb is about to explode.
I know this is a tough and controversial issue, but I do want to thank the four of you for coming on to TVO tonight and having such an energetic and engaged and yet civilized discussion about this whole thing. Peter Shawn Taylor, Pat Armstrong, Donna Duncan, Vivian Stamatopoulos. Really great to have you all aboard tonight. Take care, everybody.
It was a
Thank
pleasure.
you.
Steve.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.